Namaskar friends, I am representing Samarth IVF Center. So today our session will be having three important procedures. First is sample preparation for your IUIs and IVFs. Second will be the DNA fragmentation index analysis slides. And third procedure which we'll be going through is the PRP treatment preparation for the endometrium or the sperms. First of all, a very important thing that everyone should be aware of is this sample, as soon as it is collected from the patient, has to be kept on 37 degrees, otherwise it will have a shock. And the first step to anything is first the noticing of the count. So even we are preparing the sample, but first step should always be analyzing the count and the motility, and as you can see, the sample is totally liquefied. As we can see that the count is 80 to 90 million with a 55% of motility. Clearly see in this sample the count is good but motility is less. So this sample is actually a almost ideal sample where we will see that how this debris and the entire non-motile sperms will segregate from the motile and good sperms. First of all, we are using the density gradient method for separation of debris. So here we have a 40% gradient and a 80% gradient. Now how we'll use them is what I'll show. First of all, we'll mark the name of the patient and the time that we are collecting and the date. First, we'll prepare the gradient. We'll take the 40% solution. And we'll pour it. Inside your tube to go very slow. And now there are two methods which are being used for gradient formation. One is the overlay and the second one is the underlay. So in our experience, the underlay method is a better method. So we are using the underlay method where we have taken the 40%. Now we will gently push the 80% without disrupting our 40%. As you can see, it will displace the 40. See how slowly and gently we are pushing the 80% below the 40%. Now why this is a better method is when we are pushing gently the 80%, so there is no chance of mixing. If we are doing the overlay method where we take the 80% and then we pour our 40% over it, so there's a 5 to 10% chance that will make. So you can see clearly there are two layers. This is a little whitish layer and this is a pinkish layer. So as you can see clearly, right? Now this is the beauty of our gradient method. What we'll be doing is, we'll take our sample. So we have assessed the sample for how much motility and count. Now we know, we have come to a point where we can decide how much sample is sufficient for my IUI sample preparation. So since the entire sample, as you can see, is 2.5 ml, we'll be taking around 2 ml and using it. So I've taken the sample. Again, you will take the sample. Now gently we'll take the sample in here and overlay this. See how the sample is getting overlaid on the top of your 40 and 80% gradient. Very gently you are pouring so that there is no mixing, and all these layers are, you will observe that beautifully, they'll be very clear to your naked eye also. Now the important point is that you have to keep it at an eye level so that you are very well aware that where you are pouring. Very sturdy, with confidence. When you are doing it, you'll never have the chance to mix. As you can clearly see through your naked eyes that there are three demarcated layers. One 80%, as you can see, this is a transparent layer, little pinkish 40% layer, and your sample. So this column is 2 ml and this column is also 2 ml. Now this column is ready to run. Let's go. Once our column is prepared, we are ready to run the sample. Running means centrifugation. So we have to prepare exact same tube. So here is 4 ml and here is 4 ml, and we'll keep the tubes exactly diagonally opposite to each other. And we'll be using an RPM of 1200 for 12 minutes. Once our sample has been run after 12 minutes, as you can see, we have a pellet for our sperms here. There is a debris, as you can clearly see, in between the two layers of the 40 and 80, and this is my supernatant for the semen. So my sperm sample is here. I have to pull out the entire 3 layers without disturbing my pellet. So again, very slowly I have to pull that out, and I have to be very careful that I am pulling out the entire debris. Very carefully and with very steady hands, we have to work our way down. So you can see how the debris has come into my pipette, and I'll be discarding it. Again, we'll go down very carefully. We are pulling the entire, you can see how the debris is coming up, and the segregation is now done. See how we have pulled the debris, and we are going down, 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 down till the pellet. Now, once the pellet has formed, I'll wash off my sample with the wash medium. So how I'll be doing the washing is, I'll take 3 ml of wash medium in a fresh tube. Now I've taken 3 ml, and now you can like see, come closer. I'll disrupt my pellet, see, and mix it well and collect in the entirety and add to my second tube. Now this is a fresh tube which we have taken. Again, diagonal opposite to my marked tube. We'll be rotating this sample at 1200 rpm for 12 minutes. Now once the sample is run, you can see how beautiful pellet formation is there. And with our steady hands, we'll just pour the entire supernatant out. This is our washed sample and ready to use. So we'll again take the SW, which is a washing medium. Take a syringe. Now if this sample is for IUI, we'll be taking 0.6 of our media. And resuspending the pellet. So with 0.6 of our media, we have resuspended the pellet, and this is our sample which we'll be using for IUIs or our IVF preparation. So make sure that the pellet is totally dispersed with your media. This has to be now. The last step for your sample preparation is looking it under the microscope.